Heart Month, and I'd like to welcome our special guest, Dr. Marc Saad, a board-certified cardiac electrophysiologist on staff at P&S Surgical Hospital. Thank you so much for joining us, Dr. Saad.
Thank you for having me.
What is a cardiac electrophysiologist, and how is it different from a general cardiologist or an interventional cardiologist?
Well, actually, it's a very good question. The analogy I tend to use with my patients is that the heart is like a house. And so, like a house, you have a general contractor. So a general cardiologist knows the structure of the heart, knows the intricacies of the heart, can diagnose plumbing problems or electrical problems. They can find those problems and then refer you to an interventional cardiologist or electrophysiologist. So an interventional cardiologist is like the plumber. They go in, do procedures, find that there's any blockages in the blood vessels. If they find any blockages or problems, then they can do procedures with balloons or stents to open those blockages up. Now, I'm an electrophysiologist, so I'm the electrician of the house, or the heart. So I find heart rhythm problems and spent several years training in electrophysiology, learning procedures where we diagnose heart rhythm problems, treat heart rhythm problems. Trained to do pacemakers and defibrillators, manage those after those are placed, do what's called electrophysiology studies where we diagnose the heart rhythm problems, and ablation procedures where we go in and try to eliminate those problems.
And when would someone go see an EP?
So when people have heart rhythm disorders, a lot of times they have symptoms of palpitation, shortness of breath, lightheadedness, fatigue. In the worst cases, they will have collapse or sudden cardiac arrest.
What makes cardiac electrophysiology unique in this area?
Well, what really drew me to electrophysiology is that it's one of the fields in medicine where we do procedures and you can really help somebody immediately resolve a patient's problem. With a pacemaker, we can, if somebody's having a slow heart rate and they feel fatigue all the time, we put that in and they're immediately feeling better and have energy. With EP procedures, we can go find when people have shortness of breath symptoms or heart racing symptoms. We go do an ablation procedure immediately to resolve that problem. I've had several patients that were runners or athletes, and they have heart rhythm problems to the point where they can only go for about 5 minutes and then have to stop. I have people that have such frequent and severe symptoms that they can't even go to work. And we've done the procedure on them, taken care of them, and they're back to full activity and exercise within a week.
And what is an ablation?
So an ablation procedure is where we do an electrophysiology study, put some catheters from inside the blood vessels, put those catheters up to the heart. They have electrodes on those catheters. We diagnose any rhythm problems, like in a house, if you have a short circuit or have too much circuitry going on, we go find where that problem is. We put a catheter up that delivers radio frequency energy, burn that area of the heart, damage it so it can't carry electrical signal, and basically get rid of the circuit or the short circuit.
That's amazing. You just go right to the source. How is that different from a heart catheter?
So with a heart catheterization, they're going through the arteries of the heart. We put the catheters either through the wrist or through the groin up to the heart. They inject dye into the arteries on the outside of the heart, look for any blockage, and then they can do a procedure to try to open up that blockage if there's a problem there.
Okay, Dr. Saad, that's all the time that we have, but if somebody has any questions, they can call you at what number?
361-9900.
Okay, and you can also get that number and more information on our website at www.myarchimist.com. And Dr. Saad is at P&S Surgery Center. Thank you, Dr. Saad, so much for joining us. And up next, we're headed to the kitchen with River and Rail, so stay with us.